I'm Tim Ventura, and we're joined today by Dr. Cody Rall, an ABPN board-certified Navy-trained psychiatrist, as well as being a founding partner and former media director for Stanford Brainstorm. Dr. Rall completed his obligation to the U.S. Navy in July 2021 and is now pursuing the use of brain-computer interface technologies for mental health. He's the founder of Techforpsych, a media and relations company that covers advances in technology related to neuroscience and mental health treatment, and was also a former board member of the American Psychiatric Association's annual Psychiatry Innovation Lab. So, Cody, welcome, sir. It is a true pleasure and honor to have you with me today.
Yeah, Tim, thanks for having me.
Well, I want to start by thanking you for your career of service. I always do that to the folks that I have on who have served in uniform. And I want to start out by asking what a brain-computer interface is, and maybe if you can give us kind of a high-level overview of how this thing works.
Yeah, through technology, we can identify things called biomarkers. There's information that we can track coming from the brain, whether that's blood flow or electrical activity or even magnetic activity. And so if you translate that into a system of ones and zeros, you can have a computer analyze that data and identify biomarkers that relate to mental health, neurological diseases, but also have it translate into moving a robotic arm. So it's just a wide array of different technologies that can come through that process of digitizing brain information.
Okay. Well, so for the audience, because they may be vague on what a brain-computer interface is, when I first read your bio, I was like, what is this? And then I looked at your YouTube channel. You have a YouTube channel with a larger audience than I do. I'm jealous of that, sir. And when I started looking at it, I came across the Muse headband. I said, wait a minute. I know what this is. I bought one of those for my now ex-wife several years ago. So folks who are familiar with the Muse headband who may have seen something like that, basically this goes on your forehead, it measures brain waves, and it can provide biofeedback, right?
Yep, here we have a Muse headband and it's got electrical sensors. These are actually soft sensors that go on the band that can detect your electrical brain waves. I think when people are asking about brain-computer interface, maybe the easiest way is to identify one of the obvious examples that a lot of people have heard about in the media, like Elon Musk's Neuralink. So what Neuralink is doing, at least in their first couple of patients, is implanting sensors into the motor cortex of the brain. So when you imagine moving your arms or your legs, there's going to be electrical impulses there that you can pick up from sensors that are implanted into the brain that's sent through Bluetooth, believe it or not, back to the smartphone or the computer to analyze the signals and translate that into a movement on a mouse. And so that sort of telepathic ability, in a way, is I think that's one of the most applicable, easy to understand examples. One that's a little bit more removed from that would be neurofeedback, which probably a lot of people have heard about at this point, and that's what the Muse headband specializes in. So instead of implanting an electrode in the brain, we're actually picking up the electrical activity off the scalp, and we can use that to understand if you're calm, if you're relaxed, you're focused, and then you get audio feedback. So instead of a mouse moving around on the screen, you're actually getting audio feedback of either wind or waves or chirping birds to indicate that you're in the zone for the meditation experience and help guide you into different brainwave frequencies that are good for focus or meditation or any other brainwave states that you want to train.
Well, this is so exciting for me because this leverages modern technology in new ways to tackle age-old challenges, right? And in terms of like neurofeedback technologies, my father struggled with migraines many years ago, and he had neurofeedback machines. He tried that. I think that was big in the 1970s and 1980s. They were giving people those, but they were very rudimentary compared to what's out there today, right? So you're actually, as you mentioned, tracking electrical signals off the scalp, and apparently there are a number of different devices on the market that do this. It is not just the Muse headband. There are several different manufacturers and several different devices. Now, if I could ask, what are your top 3 favorite companies, devices, and why?
I love the Muse headband and just the fact that they've been around for about 10 years and they continue to innovate. I think that the initial part of this story and a continuing element of it is the evolving part of the hardware. So the hardware is getting easier to use, but also the software. Up until a couple of years ago, the information that you get back from it, you've got all these brainwave tracings. People have probably seen those. You got alpha, beta, delta, gamma, and theta, and you're looking at these brainwave tracings, and most people are like, I don't know what to do with this. This doesn't make any sense. What am I supposed to do with this information? But with continued neuroscience research, and a lot of it actually coming out of the fact that thousands of these devices are out there now, and we've got more data from a population of users across a wide range of ages, different genders, different things that result in different biomarkers of what they're called. You've got these different markers that tell you things about your brain health, tell you about how well you slept the night before, how well you're focusing during the day. So these are actually, the complex data is getting streamlined into numbers that people can really understand. Muse just came out with a new metric called peak alpha, which is an indicator of brain health. And I've been doing my peak alpha every day. It really varies with how well I've slept. And even if I've taken a nootropic during the day, I've actually demonstrated now that I've gotten different numbers based on whether I took Alpha Brain or Magic Mind during the day. So you can imagine how that translates into taking medications or, a bunch of other things that incorporate into your mental health. One that I really, really like that came out just this year and that are just shipping out is the Neurable headphones, the MW75s. So Neurable is a company in Boston, and they've actually, I just interviewed their founder and CEO, Ramses Al-Kade, and that's on my channel if people want to go and see that interview. But their bread and butter is actually the signal collection and amplification. So there's a lot of noise in brainwave data. As you can imagine, these are tiny microvoltage changes that are happening on the scalp from your brain. And if you get the right algorithms, a lot of it assisted by AI to filter out the noise, you get these robust signals that you can use to program different things, whether it be getting good brain health metrics, but also, programming like an AI assistant to detect when you've lost focus and tell you when to take breaks or, advise you different productivity schedules. So they've really championed soft EEG sensors as well. And the beauty of these ones is that you just throw them on and people can't even tell you're using neurotechnology. If you're using the Muse headband, I usually give the example of, are you going to sit in the coffee shop with this headband? It's fine for home use when you're meditating, but a lot of people don't want, it looks kind of weird. You don't want to stand out, most people. So if they're embedded in a pair of headphones, you're not going to see the EEG technology, yet they're tracking your focus. They're coming out with new brain health metrics soon that will give you a brain age, actually, of what it thinks your brain age is compared to your chronological age, which I think is going to be big in the longevity movement. So that's another favorite of mine that came out this year. There's a couple of other ones. Sensei is sort of a higher end neurofeedback device. And this one's different than the Muse because it's got sensors that go on the top of your scalp. But one of the really cool things about this one is they've incorporated in near-infrared light stimulation for brain health. So these are actually red light sensors that shine through your skull. And there's a lot of evidence that red light can help turn on the mitochondria of your brain, as well as other areas in your body for health and rejuvenation. And they've got a couple of other metrics. They do ERP testing. So there's a reaction time test that you do on a box, and it actually not only tests how quick you're reacting to the arrows that point left and right on the box, but it also is tracking the actual speed of your recognition of your brain that this arrow is pointing left or right. So it's actually getting biometrics of how well your brain is functioning. So there's a lot of them on the market. They're each kind of finding their own unique niche, and I could talk all day about all the different devices, but those are some of the top ones I've been focusing in on for 25.
Well, thank you so much for sharing those. The evolution of these devices reminds me a little bit of what we've seen with the Apple Watch, right? I mean, like well over a decade, maybe 15, 20 years ago now, people started wearing Fitbits, and the idea was, hey, we can track our pulse and it will help us exercise a little more efficiently. And Apple has taken that and just forced this evolution of the Apple Watch into this Swiss Army knife for personal health, right? And it's not just what it can directly track, it's what it can infer by looking at other complex data patterns. And then I think one of the next steps here is big data, right? Being able to collect and mine trends from large populations of people who are all putting their own, personal biometric data into these devices. It sounds like, from what you've described, these devices are kind of on a similar trajectory, right? Where they've started with something like biofeedback, and there's this forced evolution happening where it's going to be something much more amazing.
Well, that's the exciting part about it. And that's why I was a little frustrated with neurofeedback a couple of years ago, because it takes a lot of dedication to sit down and meditate with neurofeedback. And I think despite all the evidence, you're only going to get a small subset of the population that are really going to be invested enough in their mental health to meditate, let alone apply neurofeedback technology to that meditation. And I'm such a champion of neurotechnology. I think it has so many benefits that now that these metrics are coming out that are really easy to get, I just sit down for like 5 minutes with the Muse headband and I've got a peak alpha measurement every morning. And I've described it as a HRV for your brain. So, and then, the other thing is these companies are smart, right? They're actually, you can import this information into your Apple Health app that also has your HRV and other measurements. So I think you described it perfectly, where these brain measurements are just going to increasingly be incorporated into a big data set that you can get about all the different biometrics of your, not only your body's health, but your brain's health, and track from day to day how well you're doing, so you can sort of reverse engineer, well, did I get enough sleep the night before? What did I have for dinner? And all these different things to improve your health and longevity.
Well, again, I want to push people to your YouTube channel. Again, you are a board-certified Navy-trained psychiatrist, so you have the expertise. You also have hundreds and hundreds of videos where you go through in-depth reviews of the different products that are on the market, as well as different applications for those and how people can use them, right?
Yeah, it's been a long process of exploration and really just testing things out every day. I try to use 2 or 3 different neurotech devices every day and learn as much as I can and report it through the videos. So it's been a really interesting journey so far, and things are just heating up.
Well, since I mentioned the Apple Watch, I wanted to ask if BCI devices can integrate with Apple Health or the Google equivalent of that. I don't remember the name offhand for it. Or talk to your smartwatch, your phone in other ways. Is this something where people could put that headband on and have that data integrated into what they're already collecting through like tracking steps and all the other biometric stuff that's built into their phone?
Yeah, they can have the data uploaded. I know Mendy, for instance, one of the ones that I haven't shown yet, the blood flow tracker one, you can integrate that data into the Apple app as well.
Okay, so Mendy does blood flow then. So these... Again, this is this diversity and specialization of applications.
Yeah, blood flow is a area of research that has not as much data as the brainwave side of things, but has a lot of potential, because a lot of the high-end neuropsychiatric studies are done with functional MRI, right? So you have an MRI machine that's able to detect blood flow changes, and those are all those brain scans that probably so many people have seen since the 90s of different areas of the brain lighting up. So what's really exciting about a technology called FNIRS, which is called functional near-infrared spectroscopy, is that you can actually use a harmless red light laser to shine through the skull, and it bounces off the blood that is supplying the brain and determine different levels of oxygenation. So you can see what different areas of the brain are lighting up. And the spatial resolution might not be as high as a functional MRI, but there's a ton of data that you can get from those FNIRS scans. And people have been using it to do all sorts of things like track focus. Cognitive load is something that really applies to it, and NASA is looking into that. Measuring how well, how much stress your brain can take under stressful conditions. Like, as you imagine, if you're a pilot or an astronaut and you've got like 10 different things going on at once, and you have to keep track of all these gauges and sensors, how much can you keep track of until you start losing things and things start, slipping through the cracks and you make a mistake, for example. So that's all types of research that can be done with this technology now because it's mobile. You can use it in the field and it's not limited behind closed doors at academia or high-end clinical clinics. And this is what they call the democratization of neurotechnology. So it's really exciting time.
It is. One of the things I think that makes the timing so appropriate also is the boomer generation is aging out. I don't have the statistic in front of me, but I think that people in my age group, I'm just turning 50, people in my age group are seeing more and more of a caretaking role for people in that generation. I wanted to ask, in terms of conditions like Alzheimer's or degenerative diseases of the mind, right? Are these technologies something that you see playing a greater role in helping to detect brainwave changes, potentially provide neurofeedback to help keep people focused, other applications along those lines?
Yeah, definitely. There's already data about the evoked related potentials. Sensei has already published on this, that the ERPs, the reaction time testing, the voltage changes that happen with the brainwaves, change as way earlier than you actually see clinical signs of Alzheimer's disease in a category that they'd call mild cognitive impairment. So it's already a predictive biomarker of how well you're doing. So you've got like the tracker and the data to implement preventative measures before things get worse, which is the time frame at which you want to intervene, because you can make much better outcomes at that point before things get much worse. There's a lot of interesting things going on right now outside of just pharmaceuticals, because as you may be aware, pharmaceuticals have had a real tough time in treating dementia and Alzheimer's. Yeah. So many clinical trials have failed phase 3 testing. So I think neurofeedback can help. I wouldn't make any claims about it being able to prevent Alzheimer's. I don't think the data is out on that yet. One interesting thing that's happening right now is, believe it or not, light flickers are being looked at from MIT. So this is called the Neurovisor, and it pulses light at like 40 beats per second. This one's pretty fun because it creates a bunch of psychedelic geometric patterns on the visor. This has actually got LED lights here, and you put it over your head so it's right in front of your face, and you close your eyes. There's evidence that if you do this, it allows your brain to get out of locked circuitry. So if you think of like the brain as a system of circuits, someone with depression or OCD gets stuck in one loop they can't get out of. So it's obsessive thinking and seeing things from only one perspective. People with PTSD that maybe have had some trauma in the past and can't get their mind off of the trauma and get triggered back into those loops have a hard time breaking out of that. And that's why psychedelics can be helpful in certain instances, is allowing the brain to sort of reset and have more flexibility instead of rigidity. So these lights can potentially do the same thing. And what's been found through rat models is that rats with this that have been set up genetically to develop Alzheimer's disease early actually benefit from having lights flickered in their eyes at 40 oscillations per second. The theory is that it's actually turning on the brain's immune system to clear out plaques and metabolic byproducts that lead to the Alzheimer's. And there's a spinoff from MIT called Cognito that's actually undergoing clinical trials with promising initial results of actually treating Alzheimer's disease from light flickering. So, we could have a combination of a device that uses ERPs as a biomarker and light flickers, or, other technologies that are being looked into right now, like maybe ultrasound stimulation, that are able to treat Alzheimer's much better than pharmaceuticals ever could.
That's amazing. That's amazing. So when you mentioned light flickers, that made me immediately think of epilepsy.
Right.
Now, I used to work with a gentleman who had epilepsy, and in his case, he couldn't tell that an attack was coming on from it, right? But he had a service dog, and it could tell 2 to 5 minutes beforehand. So my question, I guess, is whether these devices could potentially be used to detect oncoming epileptic seizures, and maybe even, using some kind of stimuli, help divert those into something else.
Yeah, absolutely. I mean, some of the most fruitful interventions that wearable neurotech can do right now is tracking sleep at home. So the old sleep studies of old of hooking people up to a bunch of wires and having them sleep in some weird room are out the door. We can do that now with neurotech. It gets as good data as the old polysomnography machines can. So you can wear the neurotech at home and get the quality of your sleep and take the data back to your doctor. That's already been done. Epileptic seizures is another amazing entry point that I think is going to service so many thousands, tens of thousands of people. It definitely can be done. If you're looking at brainwave patterns throughout the day, every day, there are AI algorithms that can already pick up, seizure activity that's building up. I don't know how early the detection is at right now. I'd have to look at the recent research on that. But what's exciting is that a lot of these devices are being developed into patches that you can wear on your skin. There's an ear clip coming out later this year called Aware that I've been working with. So I'm really excited for them to come to market because I think that could be an application of theirs as well. So it doesn't even have to be fit into form factors like headbands or headphones. It could be a clip on your ear. It could be a patch on your skin that you can wear around all day, every day, especially if you're an epileptic and you want to, be sure that if you're driving a car, you don't want a seizure to come on and, that would be terrible, right? So that's something that could warn you if some sort of activity is building up, that type of scenario.
Okay. I wanted to ask about people with traumatic brain injuries. And I think that this is kind of close to your own background because of your Navy experience, right? I know that so many veterans struggle with traumatic brain injury as well as PTSD cases. And I'm wondering if this technology could be used by psychiatric professionals like yourself as part of a treatment regimen for patients with these conditions. Yeah,
the more readily available use case is diagnostics. So diagnostics of traumatic brain injury are coming along rapidly. We can definitely see EEG and blood flow pattern changes that are actually unique. When I was working at Walter Reed, which is the flagship of Army medicine in Bethesda, Maryland, it's right across from NIH. This is one of the reasons why I got into this field. I was just amazed at there's this special floor, the neuropsychiatric unit, and there's a neuropsychiatrist that works there. His name is Dr. Williamson, and he's like this tall Scottish guy who just, when he speaks, it's like poetry, just learning about these neuropsychiatric conditions. And we had all these veterans coming back from Iraq and Afghanistan that had been exposed to improvised explosive devices. So you get like shockwave injuries that happen in the brain. So a traumatic brain injury can range from severe TBI, which is as bad as getting shrapnel or a bullet through the brain that you can easily see on an MRI machine, a structural MRI machine where you're looking at like the gross structure of the brain, all the way down to these microscopic tears in the axons of the neurons of the brain that you can't see on regular MRI machines and can only be detected by seeing aberrations in the EEG signal or the blood flow patterns. And that is getting more and more precise with the AI diagnostics, the AI interpretations of the data. So the diagnostics are coming along rapidly. I know Wavi out of Colorado has done a lot of work there. But as far as interventions go, it's still really slow going. The problem with TBI is that each injury is unique, and depending on what kind of thing happened to them, they've got a unique part of the brain that's been damaged, different amounts of inflammation, different symptoms that manifest a lot of times as psychiatric symptoms. This is another reason I got super interested in this field, is like, here's actual physical damage to the brain that's manifesting as psychiatric symptoms. And a lot has changed in the 10 to 20 years since I've been in this field already. But, if you can think back to the early 2000s, if a war veteran said that they were, if they're really angry or irritable, you thought it was just PTSD. You didn't realize they had actual damage to the brain from a TBI exposure. And I think that the science has evolved a lot from there. But there's a lot of technologies coming along. There's transmagnetic stimulation, where you have magnetic pulse affecting different areas of the brain. And that can be customized to the TBI. So if you've got someone that has a lot of depression versus anxiety, you can target different areas of the brain with the magnetic pulses. But another area that's really exciting right now is ultrasound stimulation. And this is a rapidly evolving field where you can actually use ultrasound pulses to target different areas of the brain to address different psychiatric symptoms that are coming from physical damage to the brain from TBI. So no clear-cut interventions, just because it's like cancer, right? Cancer is so multifactorial and so many different types of cancers. So I think that we're going to see that with TBI. There's different types of TBI and PTSD, and not one intervention is going to work better for a person other than the other.
When I was doing research on TBI for these interview questions, I came across the 22 per day figure, right? 22 veterans every day commit suicide. And I think even more tragic than that, I had read that those values are underreported. So they were saying it starts at 22 per day, and it may be far more than that because states like Texas and California don't report their numbers. So one of the other things that I had read is the majority of people who take their own lives do so later in life, right? So people who have had TBIs in the last few years are struggling in silence often, and it becomes something where they just can't take it anymore later. So my hope is that as these technologies evolve, we will be able to provide treatment and diagnosis and therapeutic options for people, right? They'll be able to go to a psychiatric professional like yourself and, get the tools they need to help themselves. And then I think another part of that we should all just keep in mind is that we need to recognize and embrace the service that these people and yourself have given us and welcome them into our communities and our lives and give them the emotional support that they need.
Yeah, I mean, you bring up such a good point. I can talk all day about transmagnetic stimulation and ultrasound stimulation and these high-flying technologies that potentially will give benefit in the near future. But really, when you look at things like PTSD and TBI, it's like return to the basics, like proper diet, good sleep if you can, address psychiatric symptoms, but also community connection. These are all things that are really going to help people in the moment.
Especially the community aspect of it. And the only reason I'm dwelling on this is my brother is a combat veteran. And so when he returned home, we went through a very big learning process, I guess. And, veterans, they do heal, they do recover, they do have happy, healthy lives, right? But it does take a lot to help them. And having more tools, more availability for resources is a big thing. So
And I don't want to speak for your brother, but don't you think it would have been helpful if he had some device that was giving him brain metrics, something to hold on to? So he's like, here's something that I can improve, rather than just like, up till now, mental health treatment's just been this black box of like, how do you feel today? Well, I've got all these different things going on. I don't feel that well. It's like, I just feel like if people had data to cling on to, men especially, I think, do well with data and like goal setting and, moving towards specific metrics. Not that women don't as well, but I just imagine sort of like the archetypal military guy who is really by the books and, aiming to accomplish the mission. Like if you give them metrics, it's almost like a video game, like, okay, improve those metrics and you'll feel better. I feel like things would go better.
Yeah. Well, not only that, but like in the cases of PTSD, right? That was another area where I'd wondered, could it provide indicators? Are they going into a brainwave state? Can it help snap them out of it? Can it help bring them back from that dark place? I mean, things like that would be so incredibly valuable.
Yeah. One of the things from PTSD is that a lot of times it causes nighttime disturbance in nightmares and mental activity, and not always do people actually remember that they were having nightmares the next day. So one of the good things about these tracking technologies is you can track the quality of your sleep, and sleep is so essential at improving people's mental health. And from what I've seen as a psychiatrist over the years is like so many times when people come to me that are depressed or anxious or are having issues with PTSD, sleep is such a huge component. If you can fix the sleep, it really allows the brain to do what it does really well actually at night, which is clear out metabolic byproducts, reduce inflammation, and sort of reset itself so that you have the energy and acuity and your mood is just better during the next day to actually enjoy the present moment rather than just feeling terrible all the time.
Well, Cody, I wanted to ask about a comparison to Neuralink. You'd mentioned Neuralink earlier. So Neuralink is using a surgical robot to implant electrodes into the brain. There is a competitor, Synchron, which is also doing the same thing. They have slightly different procedures for it. One of the things that came to mind for me, to coin a pun there, is in the case of Neuralink, it's almost like putting an Atari 2600 into your brain, right? It's going to be outdated in just a few years. With something like the Muse headband, when the next version comes out, you can upgrade without major surgery. So it seems like that is a tremendous advantage of BCIs right now.
Well, the way that I discuss invasive versus non-invasive BCI is it's kind of apples and oranges. As far as like allowing people to control robotic arms or mouse cursors with their motor strip, we definitely need implantable neurotech right now. And that's where Neuralink is gone. And they're going to provide a ton of value for people that need these technologies. That approach doesn't always make sense. If you're trying to assess someone's brain health, it's probably better to have like a helmet or a band that gets all of the brain activity over areas of the frontal lobe, the occipital lobe, the parietal lobe. These are all areas that are communicating with each other to create a healthy and happy brain. So as you can see, if you have an electrode implanted in the motor strip, you're missing a ton of activity, right? So it's really case-by-case use cases of where one technology makes sense and another doesn't make sense. And I can tell you that I've done actually quite a bit of work with, I guess you could call it telepathy BCI, where you're actually like attempting to move a mouse cursor on the screen or send commands to a computer. There are technologies that you can wear on your scalp. Neurosity is one of them that I've demonstrated in a lot of my videos, where I can imagine doing jumping jacks or clenching my left hand and have it respond to that specific mental command, and then do something like send a message to ChatGPT to have it draw a dragon is what I did with it, for instance. So you can communicate very rudimentary with AI to do commands from scalp-related commands, but that's the limitation. It's like I either have to imagine doing jumping jacks or pinching my left hand, and so you're limited to 2 or 3 commands. Whereas you see with Neuralink, they're able to move a mouse cursor in all the different directions and navigate the internet. There's just so much more nuance and precision of control within implantable BCI that it makes way more sense to do an implantable BCI for sort of like telepathic abilities rather than surface EEG. But those are the differences, right? So surface EEG really bad for telepathy, implantable great for telepathy. Implantable probably not very good at coming up with mental health metrics, but wearable technology, best route for evaluating the function of your brain from a day-to-day basis to determine the health of your brain.
Wonderful. Cody, I want to thank you so much for your time today. This has been incredibly enlightening just to learn where these devices are and where they're going. There is so much here. So thank you so much. And once again, thank you for your tremendous career of service as well. Let me close by asking, what is coming up for you in the first part of 2025? And do you see much happening with these headband devices in the next few months of the year?
Oh yeah, there's so much coming up. There's new metrics coming out for a lot of these devices. For example, Sensei with the ERP testing is coming out with their population metrics, so you're able to see how well you are performing compared to your age cohort, which I think will be enlightening. I'm kind of curious to see the data on that. And then Neuralink, the headphones, are coming out with the brain age metric as well as other metrics that you can use from day to day to understand the function of your brain. And then keep it on the down low, but Muse might have a big announcement coming out in March regarding upcoming hardware. So there is so much going on in the space, and I'm just excited to be one of the first people testing all these different biometrics and applying to different things like I want to do cold plunge and sauna and a lot of the biohacking trends that are going on today and seeing how they impact my brain. So it's all very new and just exploratory at this point, and hopefully will lead to stronger and stronger data sets to help people make informed decisions about improving the health of their brain.
It's absolutely amazing. Cody, thank you again so much for your time today, sir.
Thanks, Tim.